Welcome to this episode of Alliance Live, where we'll be talking about our work on the cost of living. I'm Allan Faulds, Policy and Information Officer at the Health and Social Care Alliance Scotland. I'm joined by my colleague Jane, who can introduce herself and explain a little bit about why we're here today.
Hi, so I'm Jane Miller and I manage the Health and Social Care Academy, and the Academy looks at driving transformational change in health and social care, and we're focused on the cost of living really from a long-term perspective. And as you know, the cost of living crisis has been really high on the agenda, and we thought it would be really useful to explore what we've been doing around the cost of living and to share a bit about our report that we published last October. So Allan, you're going to get started and you're going to share a bit about what's been happening with the Scottish Government and the UK Government in terms of the support that they've put in place.
As we all know, energy bills are very much at the root of this crisis. Energy is, is the cost of everything, whether it's food, whether it's clothing, anything uses energy, and we all have to sort of pay the additional costs if energy bills are going up. So naturally, a lot of the government support has been around energy directly. So we started out with that, what was going to be a £200 loan for energy bills, and that was going to be paid back at £40 a year for 5 years. That was obviously quite heavily criticised as sort of being a loan rather than something that people could, just money they would get, and it's then since been changed to a £400 rebate that you don't have to pay back, so it's obviously doubled the value and not repaid. The biggest announcement though was the energy price guarantee, so that was going to cap bills sort of equivalent to the average for the household of about £2,500. Now that is still about twice what bills were before the crisis, and the important thing there is of course the word average and sort of equivalent to. If you had higher energy bills before the crisis, as so many disabled people do, and you were paying above average then, you will continue to be paying above average now and above that £2,500. So it's a good intervention, but it's a limited intervention. It doesn't necessarily go as far as it needs to for the most vulnerable. It's also meant to initially have lasted for 2 years, but that's now been cut back to 6 months. So we're very closely approaching the point of we're wondering what's going to be happening next. Other interventions that haven't been directly about energy have included the £150 council tax rebate that went to everyone in Band D households. That was something that was devolved. So the Scottish Government didn't have to follow the UK Government in doing it, but it did. And again, that was something that came in for quite a lot of criticism because it was quite poorly targeted. There were a lot of people in sort of Band D homes who maybe didn't need the £150, and because it was being given to them, it couldn't be spent more on people who had lower incomes and would have been more in need. So that was sort of something that was seen as not particularly good. On the other hand, the UK Government has done a series of cost of living payments for people receiving various social security payments. That includes disability payments, pensions, universal credit. Those have had a reasonable value, and they have been renewed for the coming year, which means it's at least another bit of sort of income that people can be sure is coming. What we know, however, is that even with all of those in place, it just hasn't gone far enough, and there has been quite a lot of hardship, as we've heard from a lot of people with lived experience.
So we believe it's really important to hear from lived experience perspectives, and that's why we worked in partnership with Disability Equality Scotland. So last August we conducted a poll with their members to find out about prescribing energy and their thoughts on prescribing energy, and Allan, I know you'll outline a bit more about that later. But one of the things that was really concerning from that poll was that 90% of people were really worried about the impact that the cost of living was going to have on them. So we thought it was really important to explore this a little bit further. So we worked with Disability Equality Scotland to host an event in October to delve a wee bit deeper into the issues. So during the event, a lot of people highlighted that they wouldn't normally speak about their personal experiences, but they felt that they needed to because of the impact that cost of living was having. And we're very grateful for everyone that came to our event. Some of the experiences were very difficult to share, but we're glad that people felt they were in a safe space and they had peers to sort of help and support them through that. What we heard during the event was that people were concerned about the bills that they had and the impact that this was going to have on them. People were concerned about their mobility equipment, about charging their equipment, and some people were feeling that they couldn't really access their scooters and that this was then impacting their independence. We also heard that people were concerned as well about the cold temperatures on their conditions. So if they weren't accessing their heating, this would mean that they had, impacts with their body temperature, regulating body temperature, and also with chronic pain. People in general talked about cutting back on everything from heating, lighting, food. Also that they were choosing maybe to support others rather than themselves. So if they had children or older people within their families, they'd maybe be supporting them rather than their own needs. What we should say as well, that this is also kind of contributing to exacerbating what was going on during the pandemic. So a lot of social care packages had been reduced, and this had left people sort of finding and supporting themselves. Also, the impacts of the cost of living crisis was not just restricted to individuals, but also to support and services as well. So we heard that that charities weren't afford to heat their buildings, that there was a rising demand of services, and also the sort of negative impact as well on staffing. And people as well in general, when they talked about the cost of living crisis, it was also the mental health impact that it was having on people. And they were worrying about their bills, when they were going to be able to eat properly, when they were going to be able to take care of themselves. And generally it was just leading to a negative impact on both their physical and mental health. And all of this is important when we thought about our cost of living approach and as an organisation what our response was going to be. So Allan, I think you're going to go on to outline what we were doing based on what we heard.
So as Jane mentioned, that one of the things that came up during our engagement was this idea of prescribing energy. So we did a bit of sort of meeting with a range of other third sector organisations to get a broader view of the things they were obviously concerned about, and that sort of idea of how people could afford their energy bills really sort of came up as that was the primary thing. And the idea of prescribing energy, effectively giving people money to cover the cost of their energy bills through the NHS as a public health intervention was seen as a possibility. And this really wasn't very popular when we asked about it directly in that Disability Equality Scotland poll, and there'd been a UK government proposal to do something pretty similar that came out just before that, which I think probably helped sort of put people in the mindset, it just went down like a lead balloon. People were quite rightly really concerned that it was going to be difficult to access, that it was going to be demeaning to go through like this kind of gate-kept process, and also that the NHS didn't have the skills and expertise or even the capacity to handle the issue. GPs themselves sort of in response to that UK government leak were like, we don't have the time or the expertise to do that. Instead, it was sort of thought that going through the social security system was seen as a much better option, and on reflection, it definitely fits sort of three important criteria for support, which is that it would be easy to access, that it would be easy to administer, and that it would be targeted at those most in need. So all of that then led to the recommendations that we made in our report, which we published in October, and those are in two broad categories. The first of which were sort of calls for immediate action this winter. And our primary ask on that front was for the Scottish Government to make £400 payments to two groups, anyone who's receiving a disability payment or to anyone who is receiving either the new winter heating payment or carers allowance. And for anyone who was getting both of those payments, so for example, we know that a lot of disabled people are themselves carers or have lower incomes, that would mean £800 in total going to those households. And that would close a large gap in the support that research by the Joseph Rowntree Foundation in September had identified that existed even after all of the various supports from both governments so far. In addition, we were also calling on the UK government to increase the social security payments it still controlled, which are obviously very significant, in line with inflation. And we've had kind of a mixed bag on that front in terms of what happens. So those social security payments are being increased in line with inflation, which is very positive. But although the Scottish Government were very sympathetic to the idea of these additional sort of cost of living payments, and they're just in a really extremely tight financial situation. There's difficulty we know with strikes, sort of getting sort of public sector pay to where it should be at this in this year. So just there hasn't been the money to do it, and they've been kind of pressing the UK government to make more funding available to the devolved government, so that's also in Wales and Northern Ireland as well, so that they can take more of these sort of direct actions. And that is frustrating given the level of need that we know exists. But if the money does become available, then we've got a lovely report sitting right there that the government can draw upon and doesn't need to do sort of costing and figuring out sort of policy ideas itself. One final thing worth mentioning, though, is that we know disabled people face extra costs of around about £600 a month on average compared to people who aren't disabled, and emergency payments can't close that gap, and they're not designed to close that gap. They are very much sort of short-term emergency payments. That sort of thing requires longer-term solutions, and I think that leads quite nicely into talking about our second group of recommendations, which Jane will be able to go into in more detail.
So the cost of living crisis isn't something new. It's driven by and exacerbates existing inequalities. And it's really important when we think about our responses that we think about the long-term solutions. People at our event said that they felt unseen by those in power, and it's really important that UK and Scottish governments work with people most impacted to go design dignified solutions and responses to the crisis. Both governments should also invest in transforming our energy system, including greater investment in renewables and alternative heating sources. And it's also important that any measures that are put in place are accessible and understandable for people as well. Both governments should work to destigmatise the social security system. It should be seen as a fundamental human right. People need to be also supported to access the system, and payments need to be accessible and adequate. Both governments should also work to make sure that they are looking at our economic approach. At the moment, when we think about our economy, it's very much focused on growth and GDP, rather than looking at well-being and human rights being at the centre. And also, finally, there needs to be more support around accessible information about what's going on, how people can be supported through the crisis, and this needs to meet people with a range of needs, including disabled people, people living with long-term health conditions, and unpaid carers. So that's a bit of a summary of our longer-term solutions and our approach at the Alliance.
Hopefully for our members and viewers, that has been a useful sort of rundown of what the Alliance has done so far on cost of living. Obviously, that's not going to be the end of our cost of living work. I think, like many third sector organisations, we will be working very hard at this over the coming months. Obviously, both governments are bringing forward their budgets for the coming years. Those will obviously have quite important sort of impacts on people's lives over the coming period. We're also always very keen to work with our members, whether those are organisational members or whether they're individuals, with any kind of issues that you identify, anything that you think needs to be raised or worked on as part of sort of a cost of living response. Obviously, please get in touch with the Alliance anytime. And thank you for watching.